someone commented that the Sengkang spirit is high. So I show you this slide of 5 staff members, doctors, nurses, physiotherapists, admin staff, jumping with joy. And actually, they just accomplished record-breaking 2 days and 2,400 serology blood draw in one of the dormitory housing migrant workers. And you could also sense that they were all sweaty because it was under quite trying and harsh conditions, doing 2,400 migrant workers, and they were all drenched. I was told that one of the MOs was so tired and covered with sweat and wanted to give up, but he looked across and actually found his own chairman, division of surgery, actually hard at work, and kind of why just went back to continue. And so in a way, working on the front line for these people, I'm not just saying about the dormitory deployment, but also in the hospital, in the ICU, doing this battle with COVID. To me, it's a little bit like going on an overseas mission, humanitarian mission to some kind of a disaster zone. It kind of infuses the team with some superhuman energy and purpose, helping these dorm workers in a place of danger and physical suffering. So the question is whether we can also translate this energy into joy and resilience, not just for the individual, the team members, but also for the rest of the organization, or even the community, both local and foreign members of the community, into some kind of a new social compact. Our foreign minister, Vivian Balakrishnan, said, this time is an inflection point, a most fascinating period in human history. We are like living through a revolution. And certainly, I think that from peace and prosperity, suddenly we are plunged into this life versus livelihood. So can we really turn this adversity into opportunity, starting with ourselves, starting with our team, our organization, and then for the community and the nation. So I share with you one WhatsApp that I sent on a fateful Sunday morning on the 5th of April, almost 5 months now. I said, hi, DMS. I'm very concerned that S11, which is the dormitory in Punggol, very close to Sengkang, was still not locked down. Today is Sunday and the last day where I think Mustafa is still open, and half of those workers may be at Little India. And I'm very concerned that when they return to the dorm, if they have ARIs, we might be the Princess Diamond cruise ship situation. On that Sunday, maybe 1x number by 24 hours, 48 hours will be 2x and 4x and so on. So that was the day that on a Sunday we were opening our additional COVID ward. In a hurry, mobilizing nurses and doctors. In fact, the cardiologist was going to run that ward because overnight we admitted 14 migrant workers and 11 of them turned out to be positive. The reply from DMS was, we are looking into this. The military, the SAF is being mobilized to do screening centers, and we'll get our act together. But by the time they got to act together, I think you would know that actually there were very, very many sick workers in the dorm. In fact, we ran medical posts there shortly after, and both daytime and nighttime, the workers who came to us, most of them were pretty sick. The average pulse rate may be above 100, 130. They are dehydrated, they're febrile, they're all hot. Even the evening clinic, we run a night clinic there between 8 to 10:30. And all of them lined up, and you could just see that they are basically, most of them, if they have fever and they have a low saturation, they are all COVID positive. So there was a lot of fear. And the next picture showed that Muntasir, one of our Bengali-speaking hand surgeon, using a loud hailer, you could see that he was working so hard that even his shoe cover fell off. And he was reassuring the workers, that we are with you. He purposely did not put on a full PPE, meaning that don't worry about your safety. Our best medical staff are looking after you. We are talking to you in your own language and trying to make connection. And because at that point they are actually very worried about their own safety, they're also very worried about their family back home. In fact, the rumor was that as we were moving these workers from dorm to dorm, trying to isolate the infected ones from the naive ones, the rumor was that because back home, if they move from one hospital to the other, they are left to die. So there was a lot of fear when we moved these people. And only after talking to them, we forming a relationship with them, and being there 24/7 with night clinic, teleconsult, and so on. We built some trust. And the next picture is really when these people are cleared and they are marching to music. This was basically a graduation ceremony when they are cleared. And that lately most of the dorms have been cleared, and they're starting to go back to work. So in fact, this is what's happening, not just the frontline deployment in the dorm, but the laboratories. These are all the serologies that we're doing. This is in another dorm in Jurong. And this is a picture of our Chairman Medical Board, Professor Ong. She's a cardiac anesthetist. And this is a big guy, very strong, but he was very frightened about the blood drawn, with a tourniquet here. And Prof. Ong was applying verbal anesthesia and talking to him nicely, asking about his family, so much so that I don't think he actually felt the needle going into the vein. So I think on top of doing a good job, drawing blood, trying to clear them for work and giving some reassurance, I think the purpose of this whole battle is also basically giving some kindness and concern and trying to help a fellow human being in distress. And I think the work was recognized by a paparazzi, one Alex Chua, who took many beautiful pictures. And this particular Instagram went viral. And here you could say the comment, I want to say I love her too. There were plenty fan club, I was told. And this is the work at the dormitory. So I was not so popular, but I was there also shoulder to shoulder with our workers at the dorm. And this is a very nice picture of them sweating away, wearing N95. So indeed, the spirit was very high, both in and out of the hospital, because of the purpose of helping a fellow human being and trying to recover them. So this is what we call the heroic phase. It's almost like a mission work overseas during a disaster, and you have superhuman energy and resilience. And this is also a honeymoon period. But what follows when the pandemic is drawn out to many months, maybe even years, is disillusionment and potentially a lot of mental stress. So the mental health capacity has never really been put under such stress. So as the number of COVID cases climb, we are in this heroic phase. But as it drop, and maybe we are very lucky, very grateful that Singapore more or less of capacity to handle is still intact, and therefore we don't have the stress of facing ICU collapsing. But still, I think as it's drawn out, we are wearing masks all the time, social distancing, lack of social contact, and all the other contributions. There is grief, post-traumatic stress disorders, depression, and suicide, not just for the dormitory workers, but also for the healthcare workers. When we were doing a small focus group with some of the migrant workers, after the first few months when they are safe, but they are still in the lockdown situation, one of the workers shared with me that, after 4 months of being locked down, he said, we were farmers, working in the field, working in the work site, we are like birds in the air. Now you put this bird in a cage for 4 months. and you are only allowed to walk within your room with 12 other workers, and maybe the corridor outside, you're not even allowed to go downstairs. They are going mad. No wonder some of them were climbing on the roof. There were some pictures that have gone viral of people attempting suicide. And I think the suicide is one of the key, but really it is a result of social isolation. Can't really sleep, and whether domestic violence in the community or in the dorm, and basically they feel trapped. And so this is all the risk factors of living alone and social distancing. So the solution is proactive intervention. But what proactive intervention, right? So that's where the organizational transformation thought came in. So you might have heard that in Sengkang, we have started on this journey on mindfulness a couple of years ago. And first, I think we're very grateful to Jennifer Davis, who's also one of the speakers in this conference. She coached our leadership team, and we went on the retreats and shared stories. And also very grateful to Angie from Brahm Centre conducting classes for our staff and other organizations as well. So we emphasize that mindfulness is secular. We welcome any faith, any beliefs, even those without beliefs is also a belief. And we are somewhat spiritual, but it is not a religious practice. And it is a practice and not a doctrine. We celebrate commune, as Father Lawrence Freeman would say, groups of practitioners who encourage each other. We never force this upon our staff as a policy, but we do open our doors. There are weekly lunchtime sessions, Friday checkouts, sharings, and we convert those face-to-face to now Zoom, and we are very happy that actually the Zoom attendance is much higher than face-to-face. And where we share stories of mindfulness, do's and don'ts, and someone said that a story is the shortest distance between you and truth. So we are very happy that now nursing, which is the largest population, they do have a mindful check-in during passing reports time in the morning and change of shift. Surgeons even have a check-in when they do a timeout before surgery, a minute of silence to drop all your wandering mind before focusing on the surgery. So it's still a very long journey, but we are hoping that eventually we'll build what we call an oasis of kindness, based on acceptance, letting go, beginner's mind, awareness of judging. Even our command center for COVID is called openness. So can we really live out these values? Is the question. But we were hoping that just as we were waiting for a valid vaccine for COVID-19, perhaps mindfulness can be seen as primary prevention for mental illness, as some kind of a mental vaccination, and maybe will lead to building resilience. So this vaccination of mindfulness through training will receive some booster doses. So here's a picture of our R cube, which is refocus and recharge and revitalize. It's a lunchtime mindfulness space. Anybody is welcome. But of course, now it's virtual. And we, as I said, we have this Connect Friday. Now it's run by various departments throughout the year. And then we have S2C2, which is a Sengkang initiative of peer support. After COVID, of course, this has all gone virtual. So now we have this building team resilience virtual program. It is adapted from IPSQ, and we have 3 modules. They are 2 weeks apart, and 130 managerial leadership staff so far have started the first and second module. So you could see that there are some electronic platform, and the material was sent out, and then they do some projects, and then they come together for this webinar. So the first module is appreciating the past, second module is embracing the present, and third module is anticipating the future. But really, we are focusing on three good things: gratitude, resilient tools, mindful self-compassion. I think the lead, Dr. Victor Kwok, is going to talk about insomnia and sleep self-care after this session. And basically, each department went out and do their own. And this is a tree, recording what are the three good things that's happened to the department and sending love notes to each other, celebrating gratitude. So this is a webinar, and this is Victor and the team. This is this is our Chief Joy Officer, Camilla, and our psychologist, Evangeline, and the Chairman Medical Board, Prof. Ong. So this is taking a selfie with all the participants of the webinar. So it's not just for our staff and the migrant workers, but we are also extending this to the family of patients and the community. So we give them a QR code for our patients waiting in the specialist outpatient, where they can access these tools and the material. And for building family resilience for the community, we're also sharing with the GPs, and we are now working to put this into Health Buddy. So a video on sleep hygiene and all the other resources so they can access on their cell phone. So we put these into GP clinic. We are grateful that Brahm Centre has also helped us embrace this, and so do all the other organizations in our area, so that we have more arms and legs in the community. So one interesting project we do in the community is together with the National Library Board as part of the Reading Well on Prescription program for mental wellness. So these are the books that are shared, and reading of the books, sleep soundly, resilience, decluttering while you are doing circuit break, and then of course exercise, fitness, and aging. So this is something that we have rolled out and have a good reception. This obviously was before COVID, but this is in the residence RC, in the void deck, where we actually fan out to share our psychological first aid tools, a bit like our mindfulness tools. So we're working so that they are trained the trainers, and they become our eyes and ears to connect those people with issues, those who have become a bit reticent and maybe susceptible to depressions, with the mental resources that's available. So in summary, I think in Sengkang, we are very grateful that we have started this mindfulness journey, which we think potentially could be a simple vaccination or first aid for mental illness. And in a way, this marathon of COVID can be a challenge, but we can also turn it into an opportunity to build personal mastery, personal resilience, team, and basically is grateful for the seeds of growth for the individual and for the organization. So keep it very, very simple. The Mindfulness Resilience Program, put it simply, is really just an attitude of gratitude. A grateful person is never depressed. So every few minutes, we think about what are the three good things that's happened to us. So when you do the next toilet break or hand hygiene, can you take an extra minute, extra moment, and take a deep breath, put on a smile, and say, I'm so grateful. What are the three good things that's happened to me while I wash my hands? And you don't have to be a Christian to say grace during meals. When you have a meal, Confucius says, 能吃都是福. If you can eat, you are very lucky. So if you have food to eat, you are hungry. And we basically also say grace. We are so grateful. And when you are in bed after a hard day's work, we are healthcare workers. We are still able to go to work every day. And it was a great day. And when you wake up, can you put on a smile, have a silly grin on your face, and tell yourself how lucky I am. So I think when the healthcare workers are resilient and happy and well vaccinated with booster doses, I think they will show joy at work, just like the first picture that I show you. After a hard day's work, they are still joyful. I think that joy is infectious. You bring that joy to the people that you are serving, whether they are the patients or the people in the community. So to end off, let me just say that I'm very grateful for this opportunity to share with you the Sengkang journey. When you go back to work on Monday morning, maybe when you wake up, the world will be a different place. Don't know who else who is going to be at the White House. We can certainly help to make it a better place. There are many people in distress that need our help, and it is within us. We have what it takes. So maybe we can all try a little vaccination dose of mindfulness, practice a little gratitude, so that we are at peace with ourselves and with a dose of acceptance and letting go. So wash your hands, smile, take a deep breath, and feel the peace and the freedom and the joy. So perhaps love is at the very moment, if only we open our eyes to feel and to observe this moment. So do wash your hands and get a booster dose of mindfulness vaccination. Thank you very much for your attention.